In this video today, we're going to talk about overcoming the unbeatable. And that is a fresh look at depression, diagnosis, and treatment. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician that helps patients understand how to be able to punch pain in the face, whether it's physical or whether it's mental, and how to get back to leading the life you deserve. Today, we're talking about depression, but we're talking about it with a new type of perspective. Normally, when we think about depression, we think about all these different types of feelings. Things like, am I a burden? Am I exhausting and it feels like I'm living in a cage? Is it hopeless and there's no person or thing that can help? Is it soul sucking? Is this something that I want to just be able to go home and just curl up and fall asleep? So a lot of different feelings that just seem isolating, just challenging, to be quite frank. And the fact of the matter is it frequently feels like it's alone. Like you're alone. And so what we know is that nearly 7% of Americans have major depressive disorder. And this was diagnosed in 2014, pre-COVID. And we know that the numbers have increased since then. Fact of the matter is, if we're trying to put this in a scale that's understandable for most people, it's the following, is that it's enough to fill every major league baseball and football stadium in the United States with people that have a form of depression by 4.5 times for each stadium. That's how significant depression happens to be. So let's talk about a different way to be able to approach depression. And as opposed to just saying, we're going to give a medication and hope it works and we'll wait 6 to 8 to sometimes 12 weeks to see if this makes a difference. Let's look at this from a different dynamic. So this paper is pretty interesting because it kind of sets the stage. It's a paper that looks at current challenges and possible future developments in personalized psych with an emphasis on psychotic. And I know it has that other piece, but one of the things that they look at is the following. It's for us not just to do an intake, but for us to say, can we be able to get imaging that gives us some assessment? Can we look at neurophysiologic measurements that can hopefully be able to give us an idea? Are there biochemical analyses that help us understand, is this mood potentially precipitated by something physiologic? Are there elements of inflammation which can result in changes in hormones, cytokines, and other biomarker levels? Can we do a genetic assay that lets us be able to determine, are there challenges and reasons for why we might have this problem and how we might respond to things? Do we need to do an mRNA or protein level of enzymes to see how they will respond to different treatments? And do we need to do any type of therapeutic drug monitoring in order to be able to say, is this medication potentially working? The other paper that really kind of gives us some further insight about this is the following, is the new field of precision psychiatry. And in that, you see this diagram that looks at how to be able to assess, does treatment A versus treatment B work? And there's a whole host of things here in the light colors that are around the corner of this slide. And the darker colors are the kind of the things that fit into each one of these things. So whether you're talking about, if you're starting from kind of the middle of functional MRI, if you're doing a cognitive assessment that looks at memory and how you're perceived in terms of your affect, how you're able to use cognitive elements, and then going after the physiological or molecular biology. Do we have aberrancies or differences that are present in our proteins, in our genes, and how those things are transcribed? Then we look at individual aspects of clinical history and demographics and such, and environment such as trauma that might lead to PTSD, and our overall physiology when we look at electrophysiology. So the paper that looks at how can we be able to improve outcomes and how do we help diagnose depression differently is this paper. And it really references a number of things. One of the things it talks about is how outcome can be affected by things different than what we expect. Many times we say, okay, well, we know having some degree of anxiety, PTSD, OCD, personality disorder, how we might feel with pain, whether we have cardiovascular issues, those things are going to be important. But what if we have different things like stressful life? Or what if on imaging, we have a decrease in certain parts of the brain, like the hippocampus? What if we have changes in terms of the activity that's present within an area that's called the anterior cingulate? Now we're getting after elements that we can be able to define, that we can see, that give us a better understanding than just how we feel in the moment, but do we have reason and rationale for why we feel the way we feel based off of criteria that we can evaluate and see, does this worsen or does it improve? And the reason why that's important is because when we can see these different things, we can then be able to target treatments to see if we can improve those things. So, for instance, this paper kind of comments on the aforementioned area of the hippocampus, which is an area that's present in the brain and that can be identified with an MRI. And when you see that there's a decrease in the volume that's present, that decrease in volume results in depression being more difficult to treat. And so why would that be important? As traditional medications may not be the thing that is going to give us the best result, but instead we need to look at other kind of more advanced therapies, whether that's the elements of using energy, like transcranial direct current stim or transcranial magnetic stimulation, or using vagal type stimulation, or dealing things with like ketamine as a potential option. So then is the elements of looking at the components of proteins and whether you have something that's called an activated microglia. Microglia are cells that surround the nerves, and it can be instrumental to how traditional nerve function works. And when we have changes in that, it can affect, and you can see that on something that's called a PET scan. In addition, we can look at how the brain talks to itself and what's quote unquote normal versus hyper versus low. And those things can give us ideas about whether things are going to work well versus not. And you can see this with doing QEEGs or EEGs that are able to assess what's going on from an electrical standpoint. And why all this matters, again, is in the following way. First, it lets us be able to see how to improve outcomes as a whole for MDD, which is major depressive disorder. It allows for us to be able to look at different markers that lets us be able to identify, can we see this in imaging? Can we see it in blood? Can we see it in genetic? It lets us be able to determine this quicker and faster. So people aren't waiting quite as long to have diagnoses being actually rendered. And then do we need to use newer type antidepressants in terms of meds, or do we need to use stimulation techniques like I mentioned before, like TMS or ECT or DBS as potential treatment options? So going into depth and detail, the following papers kind of support all this. There's a paper that looks at the effect, as mentioned before, of hippocampal volume. And what they're able to see is these changes in hippocampus made a difference in terms of how difficult it was to treat with depression. This paper looked at the aspect of how patients with major depressive disorder that had scans, what they saw, highlighted here in yellow, is that the gray matter that's present in the OFC, orbital frontal cortex, and anterior and posterior cingulate were huge in terms of how much it mattered. And the thinner they were, the more likely the depression was particularly stronger. And those are, as a happenstance, some areas that we target with TMS in order to be able to get responses after we go past looking at the traditional placement in the components of the dorsal prefrontal cortex. And then looking at these areas that are present, we can see that there are potential changes that are then correlated with the type of depression. Then are there different areas of connectivity biomarkers that can be able to define different types of depression, where we see the brain have a conversation within itself, and when we see that those conversations are not as robust or thin, it can give us ideas about the severity of disease. And we see that again repeated in a paper like this that looks at using machine learning to identify different ways the brain talks across different parts of the brain into different segments. And when those brain areas don't talk as well, we have more challenges. And there are different therapies that can be utilized to be able to improve that. In addition, there's elements of looking at molecular imaging of certain types of receptors like serotonin. We frequently hear this mentioned in the construct in the milieu of using serotonin reuptake, selective serotonin reuptake inhibitors, but we can be able to identify, is there an issue with the receptor? And by seeing that there's reductions in those receptors, which now we can potentially be able to image, we can be able to identify that this could be a potential issue, and we can try to see if we can be able to utilize that to our advantage by targeting it directly. There's ways to be able to look at brain glucose utilization and how that ends up being responsive. And we can see it in different areas that responsiveness to medications can certainly be identified by using imaging to be able to assess this. Where does this kind of come into play? Well, one of the ways that this can potentially come into play is when we look at things like the C-reactive protein, which is an area that looks at inflammatory components that are present throughout the entire body. And we know that inflammatory piece can be critical to being able to identify what's happening with depression, which most people don't know. They think, okay, when we think about depression, it's all about how I make this effort to try to see how I can make myself feel better. But an inflammatory state is believed to potentially impact parts of the neuron and microglia and other elements that then can be able to actually accentuate those being challenged. We take a look at ketamine and we say, oh, we know how ketamine works. It works with an NMDA receptor and it just makes things better. And that's what we've used for pain for years. However, it's not that simple. So what we see from this diagram, if you take a look at the blue structures, one that's present here, one that's present here, one that's present here, one that's present here, we can see ketamine works at multiple different receptors. It has a whole host of different impact. And this paper kind of continues to sort of suggest that, and it shows that there's multiple receptors that impact. And this is what gives a potential not only responsiveness to it improving depression, but also how it works so rapidly is it has the ability to be able to attack depression from utilization at multiple different receptors. And then finally, when we look at ketamine as a whole, we can be able to identify that those areas can be able to be utilized based off of dosage and utilization in combination with other things. So when we look to identify these different treatments, and you can see this is published from a paper that's President Mass General, what they found is that depression itself is undergoing a paradigm shift. And we can talk about drugs that don't necessarily just work instead in terms of weeks or months, but we can be able to have drugs that are targeted that can work to hours to days. And in this particular context, they're talking about things like ketamine, nitrous oxide, and scopolamine, but being able to utilize something that can be effective, that can help decrease suicidal rates, how we can be able to identify the problem and know what those problems are unique and can help us be able to beat supposedly this unbeatable problem and be able to help punch pain in the face and get back to leading the life that you deserve. This and these topics are topics that sometimes are seemingly insurmountable, and we don't talk about this in depth and detail, but they are things that we can be able to treat and a fresh perspective in a different way to be able to get a better result. Thank you so much for tuning in. If you found this video helpful, hit a like button. If you'd like to learn more about topics like this, about how do we push the envelope, bring a cutting edge assessment as well as treatment, please hit the subscribe button. Love for you to be able to follow us more. Thank you so much for your time. Have a great day.